It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from our readers. And the question last week was, Part 2 of My Husband Had Open Heart Surgery with Complications. He's not waking up. He needs 100% of oxygen and now he's bleeding from the stomach. I'm so scared. Help. You can check out last week's episode and question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from this particular client, I should say, which are excerpts from email counseling and consulting sessions with me. And the question this week is basically part 3 of My Husband Had Open Heart Surgery with Complications. He's not waking up. He needs 100% of oxygen and now he's bleeding from the stomach. I'm so scared. Help. This was another great series of questions where I was able to basically handhold a very anxious and distressed client through a very stressful and complex situation. So, Katie writes, Hi Patrick, oh my goodness, I have been so grateful for your advice and information. You have been right on with everything and I have been able to ask good questions and to communicate more effectively with the doctors due to your explanations to me. Mostly though, you have given me and my family hope and encouragement. For that, I'm so grateful. I'm thinking tonight I may be able to sleep a little bit. My husband is still in ICU. His ventilator is still being used for the 5th day. As you know, he had 2 open heart surgeries within 2 days only. His ventilator is now at 45% of oxygen and he has shown no improvement since early yesterday morning. He has come off the nitric oxide and he's still on vasopressors for low blood pressure. I don't get that as he had an aortic valve replacement and then another surgery to repair his hole in his heart. His blood pressure is controlled, his blood count is better, pulse rate is all over the place. His skin color is much better than after the 2nd surgery. I will see a doctor later this morning. Any suggestions or advice? I'm trying to be more in control and not follow the crowd, but go in the opposite direction. Late yesterday, they were starting to wean him off sedation slowly in anticipation of the tube being removed sometime soon. Thank you for anything you can help me with. Many thanks from Katie. Hi, Katie. First of all, thanks for your email. What do you mean when you're saying his pulse rate is all over the place? Have they mentioned that he's still in a normal and regular heart rhythm, or is it irregular? Many patients after AVR go into AF, also known as atrial fibrillation, which is an irregular heart rhythm. The usual treatment for atrial fibrillation or AF is correcting potassium and magnesium levels, as well as giving amiodarone or digoxin. If all that fails, a cardioversion is an option for management of AF as well. Also, have you asked them what his hemoglobin level is? Hemoglobin is the red cell count in the blood. If it's low, he might have lost a fair amount of blood and he might need a couple of blood transfusions. This will also help with weaning your husband off the ventilator. Normal hemoglobin levels are 80 to 135. Patients with low hemoglobin levels below 70 or 80 usually require blood transfusions. The higher and more normal the hemoglobin levels are, the more red blood cells are available to carry oxygen around the body. Therefore, the likelihood of the oxygen levels on the ventilator will come down. Overall, day 5 after 2 open heart surgeries within less than 48 hours and still in an induced coma is no reason to panic, Katie. It's a good sign that your husband is now down to 45% oxygen and that he's off the nitric oxide. That's a sign that his pulmonary hypertension has come down and that he's getting more and more stable. So far, there is nothing unusual from what you are describing and from the information you have shared. Again, keep in mind that your husband had 2 major surgeries within 48 hours. Therefore, given that oxygen levels are down on the ventilator from 100% to 45% is progress. Yes, I know and understand how frustrating it must be to watch your husband in the induced coma where you can't see him progressing physically. At least you can see that his skin color has improved. That's a sign that the VSD has closed and that now the oxygen is going where it's meant to be. Be patient, Katie. Recovery and survival in intensive care are not a sprint, but a marathon. It's often 2 steps forward and 1 step back. I'm very glad to hear that you're not following the crowd and that you are doing your own research. Don't look at what other people are doing and follow your own path and intuition. That's very important. In anticipation of taking your husband off the ventilator in the next couple of days, it's good to hear that they have lowered the sedation to get him out of the induced coma. I don't expect that your husband will wake up quickly after the induced coma and after 2 major surgeries within less than 48 hours, as well as the stomach bleed. Your husband will wake up in his own time and will take as much time as he'll need to come out of the induced coma. Waking up after an induced coma is like turning on a light with a dimmer, as opposed to switching on a light with a switch. The reason I can predict things and look ahead is that I have seen these types of situations over and over again after nearly 20 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families. It's helping you and your family minimizing the emotional roller coaster that you are already on, and it's helping you and your family to look ahead. More importantly, it's helping you and your family understanding what's really happening without only relying on the doctor's information. Doctors in intensive care are often not very transparent, and they often assume that families don't understand the medical language and the medical terms. Families understand very well what's happening if people are taking the time to explain things in detail and explain things in a language that can be understood by families and non-health professionals. Furthermore, there is so much stuff happening behind the scenes in intensive care that the doctors are trying to keep away from you at all cost. The reason for that is simply that they want to stay in control of the meaning of what's happening with critically ill patients, and they want to stay in control of what's happening with their patients and their beds. The closer you get to your own truth and meaning, the closer you get staying in control of your husband's fate and destiny. Try and be patient. Your husband may need time to wake up from the coma and recover. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.